would say about all these big procedures for the employer groups that are self-funded, meaning you're holding much of that risk, is the member on these procedures is making their maximum out of pocket. So the minute they get their maximum out of pocket, that additional liability is all of yours to take. And yes, you may have reinsurance behind that comes in and pays, but now people have gotten their care, they've maxed out their out-of-pocket, and everything they incur after that, so that overpayment of that $10,000 to $12,000 in orthopedics is actually coming out of your plan and out of your profits. And so that's where we really want to focus our attention, is on that model. And what we're envisioning is using a primary care type of gatekeeper model, but then we would have more of this concierge relationship where we would drive people, we would have them evaluated, those out-of-pocket costs for the member would be diminished, and as well, by driving people and focusing them, we would find their way to these higher quality providers. And I think what you'll ultimately see is, if we focus our attention on the 5-star and those higher quality providers, we continue to increase our probability that we'll have a better outcome and that there will be that cost savings. But even in the end, if we can get people to better quality of care and recovery, I think that's a win as well. And the monetary side hopefully will follow behind.